Imagine being born in a family where your father and mother are always fighting, there's domestic violence all the time. Father smokes or is always drunk, comes home and beats mommy. And you see that growing up. There's something it does to the child. They usually refer to them as adverse childhood experiences. Having good mental health doesn't mean that you don't get sad, but that you're able to.
There's been a 24% increase in the use of cannabis this year alone.
There is a particular hormone called cortisol. It targets aka the stress hormone. So cortisol is released in the body, and cortisol does a number of things. Part of the work that cortisol does is that, okay,
Imagine if the very thing you used to take the edge off is the same thing building a wall between you and your peace. Today's conversation is a very insightful one because we're going to be talking about how substance use has crept into the lives of today's youth in particular and how they deal with daily pressures. I'm here with the head of mental health and special projects in Lagos State, Dr. Tolu Ajomale. You're welcome, sir.
thank you very much.
Thank you so much for coming on Tiffany Speaks.
Thank
I
you for
remember the
having
first
me.
time I met you, you spoke about the dangers of gamble addiction. And after listening to you, I was like, I need to invite him. You shared so much insight into addiction. And since I started Tiffany Speaks, that's something that I've had to encounter with a lot of youth. And because society has made it so common now, it's like, it's okay to smoke weed, it's okay to take molly, it's okay to take all of these things to cope. People are using the word depression so loosely, and that's their way of, coping with it. How do you think this has really affected how people regulate their emotions normally and their emotional resilience in general?
It's a very complex question,
Okay.
um, but I'm grateful that you asked because, every day we have these kinds of issues pop up on a regular basis where people are asking questions, and we have a few divergent perspectives on it. So, for example, when you're talking about substance abuse, like you have described it and how young people are trying to use it to cope, the older generation will probably tell you that is a social vice, that they're just being weak or they're just being spoilt or they're overexposed. All of that to some extent may be true because I'm very careful about generalizing you know, in a sense. The other perspective, now so that's the social perspective, the cultural, traditional perspective. The other perspective is when you speak with mental health advocates or specialists. In their perspective, they'll tell you that a substance abuse issue is a health issue. It's a physiological, pathological issue. It's an issue that requires a medical intervention. Also very true, but also not in isolation by itself. But then we still have to ask questions about the root cause itself. Why does it appear like more people are abusing substances today like than before, especially young people? And the answers are pretty clear. On one hand, we're talking about young people, and young people are trying to find themselves. Young people are trying to understand the world that they live in. Young people are trying to know what their aspirations are. And then they're living in societies that are stifling them, are restricting them, are putting up so many challenges more than they can actually cope or deal with. And they're not things that they created. So they can't even say, well, it's my fault that these things are happening to me. Imagine being born in a family where your father and mother are always fighting, there's domestic violence all the time. Father smokes or is always drunk, comes home and beats mommy. And you see that growing up. There's something it does to the child. They usually refer to them as adverse childhood experiences. Or you have a young girl who's 8 years old or 10 and is raped by her uncle or by her father. Oh, please don't tell anybody, don't tell anybody. And you think everything is fine. The man goes on his normal life, but he has traumatized the young lady physically and emotionally and psychologically as well. So you have all of these people, some of them coming up from very difficult backgrounds. You have some other people who live in somewhat comfortable spaces, but are also still struggling with understanding who they are as people, what their aspirations should be, or maybe their parents are putting a lot of pressure demanding that they become a certain kind of person. So I'm looking at it from that young person's perspective as well. So you have all of these things happening, and then the way society is evolving, you have a lot of voices that are also around us. Normally, when you have these kinds of questions, young people would look to older people who they see as mentors to be able to ask these questions and get guidance on what they should do. But there are a lot of noises now. There's a lot of voices around. Social media has opened up the space. The internet has opened up the whole space. Technology has opened up the space. So now we're able to have conversations across globes or across continents. And we're also able to feed off of information from other people's cultures, other people's perspective. So they're exposed to a lot of information. And not all information is good information, but information will answer questions. So the right information, the wrong information can still answer a question. So you can decide by yourself that this is the information I want to go with. And then, of course, again, young people. So you're surrounded by other young people who are coming up with their own experiences, with their own background. Some young person in that same circle may be living in a space where they sell drugs on his street. And then he sees it every day. And sometimes he'll come to school to share his experience about what he saw somebody doing and how sometimes when he's going through, he inhales it, it makes him feel a certain way. And then they get curious and say, oh, okay, let's experience this. So there's the part of a certain age bracket where they're driven by peer pressure and also driven by curiosity. But then there's the other part, the people who are struggling, where they're having a lot of information around them. And people are asking questions because they want answers. And so the answers they're getting are, if you're dealing with this, I know they'll tell you to pray, but how many people has prayer worked for? And people are beginning to identify with some of the things that they're being told. And so this is an easier way. You know, it's being used everywhere. Don't let tradition hold you back. Pop one molly, you feel great for the next 7 days. Or smoke some weed and you'll be all right and everybody be happy. And, you know, and they create a lot of brand around it, a brand image to make it attractive. And so people will be like, okay, you know, young people are doing it. I want to try it. Or I'm struggling with this thing. And if this thing really will make a difference, doing it one time and they see that it does make a difference, encourages them to want to continue doing that.
So when it comes to taking substance, I know there are some cancer. I don't know if this is normal in Nigeria, but I've seen a lot of movies where they would say, "Oh, this is a cancer patient. You can have access to some maybe opioids and all of that to help with the pain." And then they use this, and they don't get addicted to it. So would you say that it's okay to take this substance on some level? And when does it now get to hit the addictive center of the brain, and then it becomes a problem?
Right. So usually the most common from the medical supply side will be pain medication. And that's where you have a lot of the opioids and they generally will call them controlled substances that require very strict prescription protocols because of the likelihood of addiction setting in. That some people would use it and not get addicted. I'm very careful to assert that because the studies have shown that 3 out of 4 people have a tendency to get an addiction or at risk of developing an addiction.
3 out of 4.
Yes.
Okay.
We've had a lot of people who, because of chronic illnesses like cancers, for example, or people who had fractures, hip fractures that had to go on very long treatments, or people on physiotherapy, who had been placed on painkillers and then became addicts because of the effect of that painkiller. But they were not primarily looking at it as a social vice in that sense. So everybody has a very strong likelihood of developing addictions. And even for those where they are being used outside, we also know that that is part of the reasons why they also have a very, 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 very high rate of substance abuse issues. To the point that part of the treatment that they're offering them is to place them on a regimen of that substance.
Okay.
So I'm trying to treat your addiction, but I'm giving you a synthetic opioid.
So it's like people were trying to quit cigarette, they give them like cigarette patch.
Something like that. So
Okay.
imagine something like that, but imagine the
Nicotine
others
patch,
for
sorry.
things like people who are abusing cocaine or crystal meth, and then you put them on an alternative, just wean them off of this. Because we are human beings, because we are living organisms, and because the brain continues to grow and continues to adapt. Once you start something new, you set up a different neural pathway within your brain that didn't exist before. If the brain is deriving pleasure from that neural pathway that you've established, it will continue to fire those cells and max it out. So it's the way cells and all those pleasure centers exist. It's kind of like when you have a favorite pair of clothes that you wear. So you wear it every day, you wash it every day, you wear it every day, you wash it every day. After a while, it fades. You say, oh, I can't wear this anymore. I want something new. So those centers are in the brain. You've maxed them out. So that's when you say, oh, the tolerance has increased. Because now you're not getting the same level of impact as you would before. And that's the way the brain, the human body works. It begins to evolve around whatever is allowing it to exist more. So if you start abusing a particular thing or just try it once and you set up that neural pathway, like every habit, once you start it and you continue to do it, it becomes the point where the body thinks it is part of its normal process. So the things that it should normally be able to regulate by itself, because there's a substitute that's coming from outside that is doing that work. The moment that substitute isn't there, this one doesn't know to do the work. So there's a gap. And then your body triggers it as though, oh, I need to have this feeling, but my body cannot produce it anymore. I need to get it from outside. But when in fact, you've actually trained your body not to do it anymore. So that's how tolerance will build. And then people begin to get addicted and then it gets worse with time. Now, different substances have different levels of addiction.
I was going to ask that, yeah.
The tendency for addiction would happen 80 to 100% right off the first attempt. Others would require persistent, continuous use for it to become an addiction. Others would take years. And very often the addiction that we usually refer in those things are side effects, much less than when you're talking about withdrawal.
Do you actually believe that you can be an addict and you're cured? Okay, now I'm fine. I'm no longer an addict. I can now start smoking weed. I can do other things, but I don't have to go back to that exact crystal meth. Is there anything like that?
Some people might say yes, but most people would say if the fact that I tripped here and I fell, might as well just avoid the whole gamut of things around it. Same way you'd have people who are on painkillers, addicted to painkillers, and they will tell you that they don't drink alcohol as well because they don't want to create a substitute for their addiction. If you already have an addiction, so there are different ways to try to treat addictions. Either you stop it completely and go cold turkey, or you create an alternative path. Mm-hmm. This is really what most people will go for. The alternative path is also equally pleasurable so that your body is easier to jump on it. Mm-hmm. But because of the kind of pleasure this is giving, it will have to be just as intense, which is very often another substance that people would abuse to be able to do that. Okay. Right? When you look at all of those things together, so an addict is at risk of becoming an addict again. I think that's the best way to say it. Right? So if you fall from a building, if you climb a building, you will always fall again because gravity will always be at play.
From any other substance.
So, like in the other podcast, we were talking about gambling as the addiction, which led to another kind of addiction. Yes. Right? So it can play across like that. So some people will say they used to be addicted to smoking weed, they want to stop that, and then they pick up gambling because they also want to get the same level of risk and reward. So usually treatment in itself is very often what is not considered the only thing. So they have done a lot of work that show that if people go into treatment programs, they get free, in quotes, of their addiction. It is a revolving door. Something would happen. Either the original thing that made you start using in the first place is still there. So like the domestic violence or lack of job or the chronic illness or whatever it is that triggered you in the first place is still there. As long as that thing is still there, you will always still get addicted to something else or back to that thing again. And then you keep going through the door like this. So the approach that they often use now is after you've gone through treatment is to set up a support group.
Okay.
Where you have other people who have dealt with similar issues. And through community, you're able to strengthen each other and then move forward. Because it's only someone who has been through what you've gone through that will understand what you're dealing with and be able to help you.
We have something like that in Nigeria, don't
we? No, actually we do.
Okay.
We actually have a couple of NGOs who are doing a lot of work around support group systems. I've actually had, the privilege of meeting with a few of them over time. Some of them here in Lagos, in different parts of the country. Some of them doing it for free. Some of them paid. Some of them set up by foundations or religious organizations to support people as well.
Because I think one of the major issues we have with that is the tag that comes with it, the shame,
Mm-hmm.
yeah, that comes with it. So nobody really wants to say anything. Um, Research shows that there's been like 24% increase in the use of cannabis this year alone, and it shows that of course there's a lot of more stress and all of that and anxiety. What would be that? I don't want to smoke weed, but I have a lot of stress. There's a lot of anxiety. What would be the healthiest way to cope with stuff like that?
Avoid the stress. That's the easiest, fastest, cheapest approach.
How?
But I mean, so the most obvious answer would be avoid the stress.
Okay.
But the question is, these are stressors that we cannot avoid. So we build coping mechanisms.
Yes.
And then this is where conversations around resilience also comes to play. By definition, when we talk about mental health, the definition in itself, one of the components of that definition talks about a person's ability to be able to cope with normal stresses of life.
Yeah.
So 3 keywords. Stress is expected.
Cool.
But then it is qualified as normal stress.
Normal, yeah.
And then the third part, coping with normal stress. So in other words, what we are saying is when some of those stressors happen, we expect that you should be sad. Having good mental health doesn't mean that you don't get sad.
Of course.
But that you're able to come to terms with whatever that thing is and then go back to how you were living previously. That's what resilience really is about. That's what coping is about. And so when you have people dealing with stressors that they cannot remove, if they don't adapt to the stress, typical evolution, then they'll say that life will continue to bring stressors because these are stressors that help us to evolve. The strongest will survive. You would either be strong enough to be able to deal with the stress or look for things that will help you to deal with the stress. The things to help you to deal with the stress can either be positive or negative. Negative does not necessarily mean feels bad. Negative can feel good, but be negative. So smoking weed feels good, but it's a negative coping measure. And interestingly, in some traditions, some cultures will tell you that it is a normal thing because it's natural, it's organic, it's made from God, blah, blah, blah. And so it's not illegal in those places. So there are some islands you'll go to, it's allowed, everybody does it because. But if you're in a place where it is not accepted, so you can go with the way things are done, right? So point here is, so there are negative coping measures or negative support systems people would use to help them deal with stress, and there are positive ones. And by positive, it doesn't necessarily also mean that it feels good. It can feel difficult, but it is positive. Now, the stresses that we talk about also are in different categories. Remember, I described normal stress. So normal stress can also be in terms of time. What a normal stress would have been for people who lived in 1922 is different from what we would describe as normal stress today.
100%.
In fact, what they would have described in 1998 or 99 as normal stress is different from what we would describe.
I think 2018
similarities
to 2020 actually when COVID kicked in. Yeah.
And so the reason why I mentioned that was because, for example, things like hypertension may have presented differently, maybe in the 1600s or 1400s. Let's go like really far back. But part of the issues why we have that now is because they describe this sedentary lifestyle.
Sedentary
Lifestyle is, when you're always in a relaxed position. So, for example, by doing this podcast, we're sitting. Coming here, I was sitting. At the office, you sit. When you're eating, you're sitting.
Yes.
When you're watching TV, you're sitting. The only time you're not sitting is either you're lying down or you're going to go and sit down, going to go and lie down somewhere. And that is not how they used to live many, many years ago, where you have to walk. You have to bend over, you have to do. So some of the things that we are dealing with now because of this advancement, they didn't have to deal with then because of where they were. And so they had their own definition of normal stress. Because for them, maybe things like getting to clear up the field all the time because they're afraid of snake bites and all of that. It's probably things that they would think consider stressors. So, what are the positive coping mechanisms? And I'm trying also to be very careful because it's different for different people. But essentially, I would focus on 5 key things. First and most importantly is knowing yourself.
Know thyself,
Very
self-awareness.
important. You need to know yourself.
Yes.
You need to know what you can cope with.
Mm.
You need to know what you can't cope with. You need to know why you can't cope with those things. You need to know if there's something you can do to change your ability to cope with it. And you need to know if you're going to be able to come to terms with the fact that you can't cope with it. A lot of people are always struggling against the tide, yes, and that's part of the reasons why they have a lot of anxiety and some of those things. So know yourself, very important. Number 2 is rest. Obviously, it's logical. But if you're dealing with stress, the answer is to rest. But for rest, people define rest in different ways. Very often, if you say rest, they'll think you're talking about sleep. But not sleep alone is not rest, but sleep's goal is to allow you rest. Some other people would rest by practicing meditation, for example. Some other people would rest by practicing breathing exercises. And some of those practices can even help improve sleep, which of course will even improve the level of rest. The body breaks down every day and regenerates and repairs itself. Part of the things that allows that process of regeneration to happen is when there's no active breaking down going on. So it means that the body needs to come to a place where it is still.
Mm.
But a lot of us may appear still physically, but our minds are not still.
Vacillating mind, right? Yeah.
Yeah, I mean, I bet people that live in Lagos can testify to it. You lived out your whole day, struggle with different things, new things are always happening every day.
Mm.
So even when you're at home at night and you're in bed and you're trying to sleep, you probably spend all of the time sleeping, dreaming about the problem and how you're going to fix the problem, and then you wake up tired. So we've spoken about knowing yourself. We've spoken about rest. And third thing is what you put into your body. So, like they will always tell you, if you visit any doctor or any health worker, oh, what can I do to get or live a healthier life, blah, blah, blah. They'll tell you to watch what you eat, make sure you exercise. Because even those things to also contribute to, your mental health, your ability to cope with stress as well. So watch what you eat would also then now dive into a whole conversation about substance abuse as well, alcohol abuse as well.
Talking about what you eat. There's something I heard, and I don't know how true it is, but you're the professional here, so I'm just going to ask you. They said if you're dealing with belly fat, you can go to the gym all you want. If you have not dealt with the stress, you can still. And I'm like, how?
Okay.
Yeah.
Very good question.
Okay.
I like that question. So the body responds in many ways to different things. So when you eat your food, there's certain parts of the body that is triggered to notify your body that food has come into the body. And hormones, for example, insulin is being released, the GIT begins to work, enzyme begin to come to play and everything. But all of those things are regulated by hormones. All those hormones are coming from the brain. Either there's a hormone from the brain that comes to talk to another hormone in another part of the body to respond, or directly from the brain, the hormone goes to the part of the body it needs it to respond to. There is a particular hormone called cortisol. Now that they would naturally they target, aka the stress hormone. The idea of cortisol is the body's chemical response for resilience. So once your body can tell that we are tearing apart more than we are building, it means that stress is happening. So we need something extra to keep us going. So cortisol is released in the body, and cortisol does a number of things. Part of the work that cortisol does is that, okay, for us to be able to deal with this stressor that is around, you need more energy. So it functions like your glucagon, for example, to release more sugar into the blood so that you have more energy to be able to deal with the stress. When it releases a lot of the sugars into your blood, the body says, we don't really need this sugar. Why is this cortisol sending this to us? All these people in national that don't know what's going on in the local government level,
Okay.
So the sugar is then converted into fat,
Okay.
and then the fat is stored. So the cortisol um, releases the sugars into the blood. The body says we don't need the sugar, convert the sugar into fat. Fat is stored where fat is stored. And the liver's primary function is to store some of the fats for immediate use. But if it sees that the zone store self is full, the next space is where there's space. And the most widely available space is in the lower abdomen slash upper hip area. So everything will go and stay there. Plus, because again, sedentary lifestyle, we are always sitting. Where again, by gravity, will the fat not go? It will stay in the abdomen. So yeah, so stress can lead to weight gain as well. Some people manifest that. In some cases, what happens is that the stress hormones causes people to eat more as their own coping measure.
Like stress eating. Yeah. Okay.
So you have people say things like stress eating, comfort eating. So even comfort eating is a stress eating disorder as well.
Okay. I'm sorry.
That stress is
Yeah.
because of heartbreak. So it is still a stressor. So very often when we think of stressors, you only think of harsh things, but everything is harsh. If you go through emotional turmoil, it's a stressor. If you go through physical difficulties, it's a stressor. If you go through financial difficulties, it's a stressor. There are different kinds of stressors. So it's also a stressor as well. So comfort eating, because you're going through a heartbreak, is a stressor.
So speaking on emotional regulation, so if you're someone who probably have anger issues, for example, are you saying that you can cope better with that if you eat the right thing?
No. So dealing with that anger issue goes back to our very first point: know yourself. Question you need to ask yourself is, why is, maybe you are the one who is angry and you have acknowledged that you have a temper problem, because some people would not even admit to acknowledge that they have anger issues, but you've come to terms with the fact that you have anger issues and then you want it to be fixed. The questions that, if you see a therapist, for example, one of the things they will ask you is understanding when you get angry. And then you begin to pinpoint all the times that your temper has flared. And then you ask questions about, why is that thing triggering you? So what are your triggers? And then why are those triggers triggers?
That it triggers there to start with.
Yes.
Yeah.
So very often you would trace it back to childhood in most cases. And those are issues that were never dealt with. So even those people need to get back to the very root of those primary problems for them to be able to get to that point where they're able to manage their anger, eat better, rest better, exercise better.
Okay, so on rest, I think we're on the third
Okay,
one.
so we've done know
Yes,
yourself,
yes.
we've done rest,
Rest.
we've done eating healthy.
What do you put in your body? Yeah.
Yes, and then next thing is exercise. The exercise does a number of things, but I'll just focus on two. One, it allows you to burn up a lot of energy. The distraction of that active burning up of a lot of energy also allows some people to mentally just rest, because now their minds aren't actively working. They're focused on either the counting routines. You know how they will tell you 1, 2, 3. It's also to center your mind, to focus on the activity you are doing and not to start wandering off in your thoughts while you're carrying out those exercises. So you're intentional about it. So that's one. So all of that energy burn up, all of that helps your mind rest. 2, when you get a good workout, there are other hormones as well that are also released in the brain that make you also feel really good. These endorphins that just get released. So if you see a lot of people who work out consistently, you can tell you that after the workout.
Yeah, I think I experienced that last Friday. I went for spin class. It was the kind of the way I felt after was like, what's going on? This might even be better than sex. Like it was so good. And yes, I can relate to what you're saying.
If you're able to do that, you also help to promote and improve your mental health as well. Help you also deal and cope with stress as well. So that's know yourself, rest.
What do you put in
eat
your
healthy.
body?
Yeah, what you put in your body.
Exercise.
There's the fifth one. Okay, yes, learning. Learning about your environment, learning about mental health, learning about new habits, learning about new things you can do. Exposing yourself to new things, learn new things. Those kind of things help your mind also grow, expand. It also helps remove biases that you may have created in yourself as well. So you do that and you cope better with stress.
So how do you know when you have started crossing the line into being addicted? Okay, maybe you're someone who say, a lot of people say, oh, I smoke occasionally, or yeah, I take stuff occasionally. When should you start to worry that, okay, I might be becoming an addict?
First of all, addicts usually don't know that they're addicts when they become addicts. And very often it's other people that point it out to them, people who really care about them, or when their manner of life, their attitude, their behavior begins to change. So you have addicts who are enabled. So these are people who are addicted to certain things, but they also have capacity to sustain that addiction. So those ones you may not quickly notice. But then there's the detrimental impact where they are unable to sustain the addiction and then they begin to do very disruptive things. So either steal, sell off properties they have, they don't go to work anymore, they don't do anything anymore because they're trying to just run to just keep the addiction going. Then there are those whose lives stop because of the addiction. So for example, some people use substance, they have zero motivation to go to work anymore. They have zero motivation to read, to do anything. They just want to just lie down, sleep, and just criticize and just be.
It's escaping time.
Escaping time. Thank you. So those are the things that you look out for. In the past, the conversations had always been at targeting the people who are addicts to try and get them to change their minds or try and get them to get the help they need. But it's hard. The focus changed to using health workers, other people, authority figures to try and enforce it. Still not working. The approach that they're currently taking is through gatekeepers. So, for example, rather than focus on the people who are at risk, focus on those who are around them, who are they are influencers or people who are enabled to protect them. So gatekeepers include things like parents. If a child is an addict, don't focus on the child, focus on the parent so that the parent knows what to look out for in the child. If it's in school, focus on the teachers so that teachers will know what to look out for in the students. If it's in the workplace, focus on the employers or the HR so that they know what to look out for in the employees. So those are the people who we are now training as gatekeepers to be able to identify and be able to refer people for the help that they need.
So I've seen a lot of people, creatives. I'm also a creative. But I've seen a lot of fellow creatives who say they are able to access their best ideas when they take substance. And it does work for them. They come up with this eureka moment, like, wow. And at the same time, it bothers me. Like, is there a way to actually access all of these things without having to take this? Or even if you take it, is there do I have to be worried that it might become an addiction if I always have to take this to be able to access this part of my brain?
Thank you for the last statement. That you also acknowledge that the substance is not the one that generates the creativity, but the substance, like you said, affects a part of the brain where those creativities or the creatives are stored. So essentially, for the most part, when people use substances, is to quiet their minds, to allow them to think better. A lot of the ideas that creatives generate is always from the experiences around them, either things they had seen, things they had been a part of, things that they had heard about. When your mind is quiet, you remember some of those things that you probably thought you would never have thought about again. And those are the things that will now inspire you to come up with fantastic ideas. The easy way to do that is to use substances. But again, it is like trying to open this door to get into this room, but rather than using the key, you keep jamming it so that you can enter.
Okay.
After a while, you spoil the door.
Shortcut.
Either the door will never open again or the door will never close again. So it's shortcut. But rather than do that, people haven't learned to be able to quiet their minds, to be able to, because they don't. We go to school to learn skills about becoming an accountant, becoming a tech boy, or becoming an engineer, but nobody teaches us life skills.
But it does.
And those are part of the issues. So people now grow up, they think that they're ready for marriage just because they have a job, they're grown, they have a beard. but nobody has trained you. So you can be a great accountant, a great preacher, but a very terrible husband because you have zero learnings and you brought a lot of baggage from your past, your own biases, your own perspective, and somebody else is also joining you in that same setting with their own. So everybody will crash in the
Trauma
middle.
bonding.
Trauma bonding.
I can relate to what you just said because it was one of the reasons why I started Tiffany Speaks. I I asked myself like a lot of things that I know now, I wish I knew several years ago. I probably would not have made the mistakes I made. And like nobody's saying these things, nobody's teaching us these things. There's always an easier way. There's always an easier way of dealing with situations, but nobody says these things. Just say, "Oh, go pray."
Well, sometimes it is because those people probably haven't even figured it out themselves. So they'll tell you the easy answers. You know how you talk about Nigeria with people and then everybody gets all riled up and at the end of the day we all conclude, it is well.
You go better.
Or it go better. God will shall do it.
Go with it.
That's how you know that okay, we've concluded this conversation. And everybody has come back to the
So
same point. So yeah, it's kind of like
the
same thing.
baseline.
So
So for people who are struggling with addiction, I don't even think you have to say, "Oh, I'm addicted" before I need help. I think taking the substance to start with is already a problem. It's already a cry for help. It shows that you're trying to substitute for something, like you said. So we have people who are addicts. How do they get help? Where can they go to?
okay, so I'm very tempted to try and sell certain people, but I also want to be as honest and as open about it as possible. I would say, first of all, you can search. If you do a really good Google search, you would find private hospitals or private facilities that are offering care. And I know a lot of people that will go private because they don't want anybody to know about these issues. I know families who pay for their children to get private care because they don't want them to spoil their family name. So their private providers are available. We have people who can't afford to pay for care. So we also have NGOs, charity organizations who are also doing incredible work. They have different models. So if you pick a church-based NGO, the part of the therapy model would also include using, the Bible. And so some families, some people prefer that approach. We have those who are using the more scientifically, more conventional, contemporary medical practice approach as well, who are also NGOs and are doing it for free. But all of them usually work with a first come, first base, first come, first serve basis. NDLE also has one treatment center in Lagos. I know they have a couple of spread across the country. I think they only are able to admit about 6 or 12 patients per time, and they're more or less always full. So we also have, government facilities as well. So you have the Federal Neuropsychiatric Hospital in Yaba, you have the Lagos University Teaching Hospital in Yaba, you have LASUF in Keja. We also have some of our general hospitals who we're also empowering to also be able to provide services as well.
How discreet are the services though?
So the good thing about the integrated model that we're chasing is that if you're going through a general hospital, nobody knows what you're coming for. Because more or less, you walk into a general hospital, it could be that you have malaria or you came to see someone that just had a baby and then you walk back out and everybody's happy. If you go to Yaba, for example, very stigmatized because everybody knows the kind of service they offer there. So we're using a more integrated model of care now to reduce stigma, to increase access to care for all mental illnesses across board. But specifically for substance abuse, while all of these facilities, government-owned, privately owned, NGOs, faith-based, exist, I'm also always very intentional about putting out a note of caution. But please make sure you do your research very well before you decide which facility you want to go with.
I remember there was a time I wanted to, I think it was like 5 years ago, I wanted to talk to a therapist so bad. And I went online. I'm not sure if I should say this on camera. And I went online, got someone who I thought was a licensed therapist. The rest is history.
Sometimes when I'm meeting with providers and we're having events or conferences, I always tell them this example. I know someone who established a website and then they had So they called it something where it's like a space where different mental health providers exist. So you can come check and pick any one based on their specialties. So I was scrolling through, I was like, what's this? I was scrolling through, and then I saw a couple of people like, these people are not mental health providers. And I saw my cousin's name on the list as well. So I called and I said, when did you become? I said, no, there's a friend that set up a thing and said, oh, you like to listen to people, so come and
Oh
get paid.
wow.
And then they put different charges: 45,000 per hour, 130,000 per hour, 20K per hour. And she was like, there's extra cash on the side. So I think she did 15K per hour or something. And then she got one. She said when she listened to that person, she knew that this is not what she should be doing. That these matters exceed
This
her
one passed
capacity,
me.
pass
He
her.
passed my power.
And so you have a lot of people out there
Yeah.
like that who are taking on cases that they don't have capacity to deal with. But when someone actually has a present suspected case of a diagnosable mental disorder, they shouldn't be managing. So that will include things like people with diagnosable depression, anxiety disorder, substance abuse, for example, psychosis. The real issues, it's not life coach work again. Some people will say they are going to meet their pastors or go and meet their. I'm happy that today more pastors are becoming more aware.
Yes,
And
yes.
so they're also building their skills
Yes,
or
yes.
also
More
educating their
knowledge.
members about where to go to get
Yes,
help.
to get help.
So I think that's a good progress. And we need to keep that up. Lagos State also has services available as well. General hospitals, like I was talking about last week.
But this is for treating addicts, right?
Yes.
Mm-hmm.
So we also have the Ministry of Youth and Social Development that has some treatment facilities as well. And I think theirs is also free, but there's a whole process you go through before they take patients in. Now, with all of this that I've said, the demand is far more than the services that are available.
Yes.
And all of this I've said, it's available in Lagos. Many other states don't have that mix. Some of them only have maybe one federal institution providing care. Still, not enough. So the goal has always been to try and see how we can improve on prevention. But when people have this problem, the reason why I mentioned that is, first of all, to state the urgency of the issues and also to state the opportunities that exist. We need more treatment centers for drug abuse, for different classes of people, for those who are willing to pay, for premium services, for people who can't afford care, but this addiction is causing problems in their homes, for people who are looking for a more traditional approach in terms of, using the Bible or using to try and teach and use as part of their therapy tools. People who can afford to pay, but they can't afford to pay premium. So you have a lot of those people as well. So we need services for different categories of people. So if you're a provider, there's an opportunity. But also for the public, we have a big problem. So we don't have enough space and we have a lot of people that need help. Try and see what you can do to prevent them from having issues. Or immediately you recognize that there's a problem, seek help very quickly. Seek help very quickly.
Because we talked about where to get help for addicts now, but we started this podcast by saying that most of these issues are we should address it from the root, which is what trauma are you dealing with? Is there like a trauma-based NGO in free?
Yes. So we also have people who are working in trauma space, and this is just mental health trauma alone. I have a particular fantastic woman. She's a professor of mental health in the US. She has an NGO that she works here in Lagos. Started a few years ago, trying to expand and set up spaces in different places. Currently, I think she's working in Ikorodu, providing trauma-informed care for people who are dealing with different kinds of trauma as well. So we have quite a few people doing a lot of work, but I think part of the challenges is that they haven't built enough capacity to be loud enough for people to know, or they don't have capacity to be able to take on more than they can currently accommodate, so they don't want to make themselves too out there. And then the other part is also the red car theory. You would only look for it because you need it. So if you didn't need it or didn't know anybody needed it, you won't know that it exists.
True. True. I didn't know you existed. I mean, up until now. Well, thank you so much, sir, for coming on this podcast. It's been such an insightful conversation with you, and I'm hoping that I
Oh,
can
yes.
have you. I
Okay.
can have you here more to talk about so many other things because mental health is not a joke. Um, I have people. I read some stories. And I'm like, I'm not licensed to help you.
Mm,
There was a video I did on TikTok, I think about 2 months ago, and it went completely viral. I had like over 2.6 million views
wow.
on it, and most of my followers are young people,
Mm,
20 and all of that. And they sent DMs. I'm going through a lot.
mm,
I've been raped. I've been this. I'm like, okay. I
mm.
know this was something I picked up because I've always had the nudge to do it, but I didn't. Even when I started, I didn't understand how big it would get. But over time, I'm starting to realize, okay, this is actually bigger than you think.
You know what I like about what you're doing?
Tell me.
So while the immediate focus is on how it is a platform,
Yeah.
you need to also take responsibility for what that platform will do. And I like that people have been reaching out to you, to ask for help because they recognize that this is an opportunity for them to get heard. So you're providing opportunity for people to express themselves, to be heard. You're providing information to them, and it is also triggering them to look for help. But also then it puts a sense of responsibility and accountability on you to make sure that you are giving them the help that they need.
Mm.
Which means that you also now have to do a lot of work to ensure you get all the resources, the right
Exactly.
information
Like, that's why I reached
everywhere
out
to
to
be
you.
able to help.
That was why I reached out. When you responded, I was like, "Yay!" I'm so excited. I was so excited because I hosted an event, I think 3 weeks ago, and it was for young people. Yeah, I think SS3 students in Lagos. I was the moderator of the event. We held at National Stadium, and I asked a question. I asked, how many people here want to be a doctor? And I just saw a few hands. And I said, okay, how many people want to be a celebrity? Everybody was.
Yeah.
So I'm like, this generation, God, we're in trouble. We're in trouble. Everybody wants to be a TikTok influencer,
Yes,
Instagram
so.
influencer. And I'm
Yes,
like,
so.
where is this going? There is need for this kind of information
Yeah.
now more than ever. Thank you so much, sir, for
You're
coming.
welcome. But I always ask, if everybody becomes an influencer and there's no product, so what are we going to be influencing?
Because everybody's looking for shortcuts. Nobody really wants to do the hard work anymore, just behind social media money. And but I mean, that's why I am here. That's why Tiffany Speaks was born, and that's why I get to meet people like you to help on this amazing journey. Thank you so much for sacrificing your time to be here. I mean, it's work out, for God's sake, and you're here. Thank you so much.
It's worth it now. Tiffany Speaks. We're going global.
Yeah, so going global. Thank you so much, guys, for joining me on this episode on Tiffany Speaks. I hope you have learned a lot. You've learned a lot from Dr. Tolu Ajomale. If you have questions, please send it to my Gmail, and I'm always here to listen. You know what this platform stands for. Is for gaining confidence, discovering your purpose, dealing with whatever trauma it is that is plaguing you, and of course knowing how to effectively regulate and manage your emotions. And until I come again your way, it's your girl Tiffany, and I say peace.